for the introduction. Thank you for the invitation from the organizers to present today our results. I'm representing Dr. Kahili, who is the first author, leader of this project team. She's one of our neuropsychologists, and she couldn't make it today. Also, just take the opportunity and recognize everybody who worked very hard in this and other projects looking at outcomes after proton radiation. And many of them are here, Dr. Chittagumpala, Dr. Polina, and Dr. Mahajan. And the most important person among those names is Heather Stencil. She's a pre-doc neuropsychology student. She finds all the patients, she consents them, and she does the testing. Also, we have to recognize that US has had a wonderful run in the World Cup, and they lost today to Belgium. Congratulations to the Belgian colleagues. They'll be back in 4 years, they'll be stronger, so please be aware. So, we all know radiation therapy is an essential treatment option for many pediatric brain tumors, and we're all aware that there are significant neurocognitive late effects that are associated with it. Declines of 2 to 4 IQ points per year have been reported by a number of groups after cranial radiation. And the risk is increased with younger age at radiation, higher radiation doses, and larger irradiated brain volumes. We heard yesterday, because of the special properties of the proton particles, there is a hope for potential neuroprotective effects of the proton radiation. But to date, there hasn't been any human studies conducted comparing patient outcomes treated with proton versus non-proton forms of radiation. So we set to do that, and we aim to identify differences in global IQ change over time between pediatric brain tumor patients treated with proton and photon radiation. The proton cohort started after the facility was available for our patients at MD Anderson Cancer Center since 2007. And we selected photon counterparts from the period that was 5 years prior to that. Age at radiation was selected as 18 or younger. We included all histologies other than high-grade glioma, brainstem glioma, and ATRT. We identified 99 patients who had at least 2 IQ assessments done in time, and 55 were treated with proton, and 44 were treated with photon radiation. We used a general linear mixed model to examine change in IQ over time by radiation type, controlling for important clinical variables. Here is the descriptive data in the next 2 slides between the 2 groups. Basically, there was no difference in terms of gender or age at first IQ. Because of the difference of diagnosis periods, there was a difference in terms of IQ evaluations per patient and last IQ to RT intervals. There was also an overrepresentation of the patients who needed a VP shunt in the photon group, but as you see here, there was no difference in terms of age at radiation. Here I'm showing you just the raw data for the proton group only, and we see here 2 things. Point your attention to the first year. The proton patients were distributed equally above and below the population average, which is 100. And in time, either you can say there's a small decline or there's a stable trend. When we look at the photon patients, which obviously had longer follow-up, at baseline, these patients were slightly more impaired, and you can clearly see a trend in time that's declining. This is the main results slide that I'm going to walk you through. This is the multivariable analyses of all the important variables that we kept in the model. So first variable is RT type. That's looking at comparing all proton patients versus all photon patients, all numbers compared over time. So in average, photon patients had IQ scores about close to 7 points less than the the proton patients. The second variable is looking at just time. And that showed that all patients, again, there's no separation there, photon and proton patients had an IQ change 1.1 unit every year after radiation. The third variable, which is the most important variable for our study purposes, is an interaction term created between time since radiation and the radiation type. So that showed that photon patients lose, in average, 0.3 more units per year than the proton patients. But that interaction did not reach statistical significance. We wanted to look at that baseline difference in a bit more detail. So I'm showing you over here all the data for the first year assessments. Blue circles for the proton patients and purple triangles for the photon patients. And as you see, the proton patients' average was right at population average, 100, but the photon patients' average was about 9 points lower than that, and this difference was statistically significant. We don't know why we are seeing this. It could be just the sample itself. This is relatively large sample, but it's still considered a small sample. We have a couple of hypotheses that we're interested in looking at early effects that the patients treated with photon therapy may be more vulnerable to early effects of radiation. The other implication of this difference in baseline, but a similar trend in time, is the following. If these results are true, and these patients are followed in time, patients treated with the photon radiation would drop into clinically significant values much earlier than patients treated with proton radiation. In summary, both proton and photon radiation are associated with cognitive impairment. Photon radiation appears to be slightly greater cognitive impairment than the proton radiation. IQ scores in the photon group started lower and remained lower compared to the proton group. The rate of IQ decline did not differ significantly between proton and photon patients in this sample. Different length of follow-up between the groups may have contributed to these results. But the bottom line with this data is that the long-term impact of proton radiation on IQ remains unknown. Obviously, we had a number of limitations. This is a retrospective study. There was no randomization. It's a small heterogeneous sample with multiple diagnoses. In future analyses, we will include RT dosimetry, intensity of chemotherapy, history of posterior fossa syndrome, and other variables that are related to cognitive impairment. I thank you for your attention and we'll be happy to answer any questions.